So today I'm going to talk about the FY2 Standalone Interview. So if we start with an overview, if you sat the FY2 Standalone SJT, that's only used to shortlist candidates for interview. Once you get to interview, all that matters is how well you do at interview. It's not possible to bypass the interview no matter how well you score in the FY2 SJT. So first thing is that there's a fixed number of interview slots. They usually interview roughly 3 candidates for every 1 job. For example, in a year where there's about 160 jobs, they're going to interview about 480 odd candidates. Some years there's 200 jobs and they might interview 600 people. The interview itself is done on Microsoft Teams, lasts about 20 minutes, and there'll be at least 2 panel members, sometimes 3 panel members, with 1 or 2 clinicians. And what they're looking at ultimately is your suitability to work as a junior level doctor. FY2 is someone junior, and that you're going to be safe in that role as a junior doctor. So in terms of the format, there's 4 stations which are equally weighted, and then they also assess communication and English language. So the 4 stations. The first one is CV and employment. This is based on things that you put down in your application. So they might ask about things like career gaps, about involvement in research, audit, quality improvement activity. Then there'll be 3 clinical scenarios, one of which may include ethical dilemmas or ethical issues and scenarios. They might ask you about a difficult situation at work and how you might approach it. But the other 2 tend to be acute clinical scenarios. How you might deal with, for example, someone who suddenly collapsed, a patient going into anaphylaxis, a patient with an acute severe asthma attack, a patient that's bleeding out. And what they're looking for is both your clinical approach, but also that you think about your role as a junior doctor, know how to escalate appropriately, that you're safe. As I mentioned, the 4 stations, so employment and 3 different clinical scenarios, they're all equally weighted. But then throughout the whole process, they're also assessing your communication skills and your English language. So you get a total score out of 100. This is the mark scheme that they use. So you can see there's 2 panelists, each give you a separate mark. So maximum of 20 marks for each of the 4 stations. And then 10 marks maximum for communication, 10 marks maximum for English language, giving a total aggregate score out of 100. And then using that score, they'll have a cutoff. They haven't announced what the cutoff is. They don't decide that till afterwards. But anyone below the cutoff will be deemed not appointable, i.e. your interview score is too low to even get a rank at all. Everyone else will be deemed appointable and they will be ranked based on those interview scores. So I'll give you an example. Let's say there's 160 jobs. About 480 doctors sit the exam. Let's say 80 have a score too low to be ranked at all. You're left with 400 that are going to get a rank, but there's only 160 jobs. So not everyone that gets ranked will get a job. Being ranked doesn't guarantee you a job, okay? It depends how well do you score, all right? And they will give you a breakdown of the score. So they'll give you the mark scheme that looks like this with some comments from each of the panelists so that, if you didn't score well enough to get an offer this year, you could look at it if you wanted to try to improve, not just for this, but it might help you for other interviews, all right? It's also not possible to appeal your scores or your outcome, all right? So how can you prepare? Well, ultimately, you want to be familiar with how to deal with various different clinical scenarios. Look back through your application. If you've got any career gaps, if you've been involved in research, audit, you've mentioned things like this, expect them to ask about it. So be prepared for that. And then be familiar with GMC guidance, which you already would have read for the SJT anyway, because some of the ethical dilemmas, they may involve assessing how you might deal with issues like confidentiality, like, concerns around a team member. And if you can tie that into what the GMC recommends you use in approaching that, that can be useful. So beyond that, the other thing that can help is to practice. So we do have a half-day interview preparation course dedicated to the FY2 Standalone Interview, specifically for this format, where we get a chance to volunteer and have a go. We'll go through all 4 stations. I will give feedback, but I will also demonstrate how a really high-scoring candidate might deal with some of these challenging areas. So I hope that's useful to get an idea of what to expect and how to prepare. If you do want support, we do have a course and also one-to-one coaching for the interview. I'll put details about that below. Wish you all the best with getting a suitable score in the FY2 SJT so that you get an interview and then smashing your interview so you get not just a job, but your top choice job. Ultimately, prepare and you will succeed. All the best with it.